Good morning, everyone, and welcome to the first 2024 SBI chat hosted by the Newsletter Committee. Today, we have with us Dr. Smetherman, who becomes the first female CEO for American College of Radiology. Dr. Smetherman is the chair of Department of Radiology and associate medical director for medical specialties at the Ochsner Medical Center in New Orleans. She is also a past member of the board of directors for the hospital system and also the secretary and treasurer for ACR currently, also on their board of counselors. She also served as the chair of ACR Breast Commission, ACR Counselor for Louisiana, chair for the ACR Breast Imaging Economics Committee, president of the Radiological Society of Louisiana, board member for American College of Surgeons of National Accreditation Programs for Breast Centers, the ARRS advisor, and the list goes on and on. So, welcome, Dr. Smetherman. Thank you for being here with us today. You're also a fellow of Society of Breast Imaging, and we are so lucky that you took some time out to talk to us today.
Well, thank you for the opportunity to chat this morning. I'm so glad we were able to make it work out.
Thank you. So, you've had a long, successful career. Tell us, how did you land in the field of breast radiology?
So thank you for that question. I not only did I not start out thinking I was going to be a breast radiologist, I didn't even start out thinking I was going to be a radiologist. When I graduated from medical school, and I got both an MD and a master's in public health when I was at Tulane Medical School, I went into neurology. And there was no one else in my family who was in the healthcare field, hadn't been for several generations. And I think I made that decision because I loved neurology. I loved reading about it. I loved the problem solving. I loved figuring out what was wrong with the patient. But the challenge was when I actually realized what I was going to be doing in the clinic, I realized that it was really not a great fit for me. At that time, there were not a whole lot of therapeutic options for patients. A lot of what they needed were really social services. And at that time, the resources just didn't exist. And I could just see that as much as I loved the diagnostic side of radiology, of neurology, it was not going to be a satisfying career. So I made the very difficult decision to take a step back and think about not just what do I find interesting, but what do I like to do? And I realized what I really liked to do was figure out what was wrong, help solve the problem. And so looking at other specialties, I was fortunate enough, I was at Yale at the time in neurology, and we spent a lot of time with the neuroradiology fellows and the radiology residents. And back then, the neurology residents had to approve all of the head CTs after hours. And I was like, I never even occurred to me that radiology might be the right field for me. When I was going through medical school, I think I had a very traditional idea of what a physician was going to be. And I was like, I really get excited by figuring out what's going on with the patient. That's where I really get the joy of practicing. And so I was fortunate enough to be able to transition and go back to Ochsner in New Orleans for radiology residency, which is where I had done my internship before I started neurology residency. And when I went into radiology, I was very intentional about not being like, okay, well, neuroradiology, that's it. I actually went through every different rotation, tried to be really open-minded, and landed on breast radiology because, again, it kind of has the whole spectrum. And it was a very exciting time in breast radiology. Core needle biopsy was really just coming about. Screening was really coming forward. Sort of had the excitement of population health and being the one to find those little early subtle changes, work them up be able to be the one that's guiding the patient through this process, do the biopsy, and find those little early cancers that were going to make a big difference. I also really enjoyed the teamwork aspect of it, and I've been very fortunate in my career to work with some really wonderful, not just radiology teams, but multidisciplinary teams with fellow colleagues in other specialties. And so it was a little bit of a long and circuitous journey, but I think at the end of the day, I wound up in a field that really was a perfect fit for what I was good at and what was also the things I liked to do. So
Wonderful. Thank you for sharing that amazing life story. We see that you lead a really large department at one of the top hospital systems in the country. So, what are some particularly challenging aspects of your career related to leadership role?
That's a really great question. And I definitely have had more of the Sheryl Sandberg jungle gym path of my career than necessarily like a straight line. I'm going to be goal driven. So, uh, I think some of the challenges, I think for all of us when we transition from peer to leader, that can be an interesting challenge and how we maintain those relationships, but understand that they're different. So I think we have to be aware of that as we're going through different roles. Um, I am not particularly change averse, but that is maybe not the norm, or certainly not the case for everyone. And I think one thing that I have really learned, and has been challenging, but I've learned, is that a lot of leadership is really change management. And I feel like, in particular in the pandemic, I actually came into my current roles less than a year before the pandemic hit. It was very interesting in the pandemic how it was like change management on steroids, and trying to, think outside the box all day long, which in some ways for me was kind of an invigorating challenge, as difficult as the situation was. But I have really learned how important change management is, and how much there's really kind of a spectrum of how much different people struggle with change. And then I also think, and this kind of comes from the interest that I've developed over the years in healthcare economics. The United States healthcare economics is very complicated. And I feel like we are constantly dealing on the provider side, or those who provide healthcare services, with constrained resources. It seems like we never have enough people. We would always like to have more equipment. We would always like to have a new facility, and balancing those needs in a field where we are very much the price takers. A lot of our the payment for what we do is determined by the government. And as many positives as there have been with the Affordable Care Act and the expansion of coverage for so many more people, the already complex American healthcare system has only become more complicated. I think, healthcare providers struggle to understand the nuances of all of the different kinds of insurance coverage in the United States now. And if we struggle, oh my goodness, our patients, it can just be overwhelming. And so many patients, want to know, why did I not have to pay out of pocket for this last year? And I'm on the same plan, but I'm paying this year. And so I think helping my colleagues and my administrating colleagues and all of us figure out how to navigate an environment where we are almost certain to have resource constraints has been another interesting challenge, I would say, and difficult aspect of the job.
Yeah. Now, thank you for sharing that, because economics aspect, even within breast imaging, is so important, and you understanding it so well, put in such a unique perspective. That staff shortages, everyone, everywhere, it's just hard to hire, and the costs keep going up, and the prices keep going down. So we are so thankful that you're here with us to uh, spread your knowledge with all of us within breast imaging community, in addition to ACR.
Well, thank you very much for that. And I do think it's something that, I am constantly learning still about all of those things, in part because they also keep changing from year to year. So
It's an ever evolving learning process. You're so
yes.
right. You recently got appointed as the first ever woman CEO in the 100-year history of American College of Radiology. So big congratulations on that. We are also proud of you. How did you get started at ACR and reached this level in your career?
So I have been fortunate to be involved in the ACR at some level pretty much throughout my entire career. First and foremost, as just a member of my chapter of the Radiological Society of Louisiana. And then I was asked to consider becoming an officer. And so I was the secretary treasurer, then became the vice president, then became the president. I was able to attend a lot of those annual radiology, American College of Radiology meetings in Washington, D.C., first as an alternate counselor and then as a counselor from Louisiana, which was really exciting to see this entirely different aspect of radiology as I knew it and meet such interesting people. And so I was fortunate that Louisiana supported me to be able to go and be involved in that. So I went sort of that traditional chapter member to chapter leader to counselor route. But then I also had the chance to be involved in a lot of other ways in the ACR. And I would encourage people, the ACR has so many different ways you can be involved. So I have been for many years a clinical image reviewer for breast ultrasound accreditation, and have learned so much through that. And I always had an interest in quality and quality improvement. And so that really dovetailed nicely with that. And through that, I became a member of the breast ultrasound committee. And then as I became a little bit more interested in economics, I had an opportunity to start working with the Coding and Nomenclature Committee and the Economics Commission, and then be able to be involved with the CPT team, became an alternate advisor and then an advisor for the Rank and Race Society to the AMA's CPT editorial panel. So again, just different ways, but always meeting just these wonderful people from all over the country and learning so much from them. I also was part of a very, very special program, and that was something called the Screening Leaders Group. And so this was something that was founded now probably 7 or 8 years ago. And they realized basically, and kudos to ACR leadership, that really those pioneers of breast imaging who had fought so hard to prove the value of screening mammography were getting a little older, and they wanted to train a new generation of advocates. And so I was part of a group. I think originally it was about 16 or 17 of us, and it was a pretty intense experience. We had a whole lot of training about the science of screening, and why 40 and annually really has the best evidence to save the most lives. But as always, as you know, in breast radiology, it seems like there's always some new attack against screening, and it comes from different sides. And so we learned how to do things like write a letter to the editor. And I was fortunate enough to get some letters to the editor, both in the lay press and in the medical journals published as part of my involved in that group. And they really taught us how to do that. We had to do practice exercises. And they even gave us media training, which was also fantastic. So I was able to be part of that. And then did some committee work with the Breast Commission, and then was asked to be the vice chair and the chair of the Breast Commission, and then serve on the board of chancellors. But this is over, as you said earlier, a long career. So I feel like I was lucky to have the chance to be involved in lots of different ways in the college, not just one. And I do think that points out the fact that there are lots of opportunities at the ACR. Not everybody is going to find they have a passion for healthcare economics like I did. It may be people who really are fired up about quality, or data science or things like the practice parameters. And so, having the chance to volunteer, but volunteer in so many different ways, I think is something I was able to take advantage of, but also provides opportunities for lots and lots of other people like yourself. So.
Thank you for sharing that. That's so motivating. So, what keeps you going and be persistent to continue to be involved in all of these leadership and advocacy roles outside of your clinical work, where you also lead a large department? It would be great if you can share some high points in your career in the last several years that, puts it all together, makes it feel worthwhile to put in all of this extra work you do for us.
Well, I think having the opportunity to meet so many bright, knowledgeable people from all over the country, I think has been sort of the continuous ongoing high point. To learn about new things, hear their new ideas. I always say 85% of problems are common and maybe 15% are local. And so if someone else has solved a problem in a different way, so that's certainly an overall high point. I did have the chance to help write a bill with a surgeon colleague here in Louisiana that's insured coverage for high-risk screening in our high-risk breast cancer patients. We worked with a lobbyist who actually is a very big breast cancer advocate and had been involved in politics in Louisiana. And so we worked together. So that was a high point. I hadn't done something like that before, and that's fairly recent. And then also, I guess, another high point for me personally has been my involvement with the CPT team for the ACR and the other medical specialties. We all work together to be able to help write the code for digital breast tomosynthesis and get that passed, to be part of the process when we had mammography, screening and diagnostic mammography, revalued breast MRI, all of these different things, breast ultrasound. So I would say those are probably some major high points in recent times. I also think being able to have the honor to lead the Breast Commission during the height of the pandemic was another, turned out, I think, to be a high point. Very challenging, but to have the chance to kind of, at that time, really be able to spread best practices at a time when we were all learning from each other just how to keep ourselves and our patients safe. So I'd say, kind of in the recent years. Yep.
Dr. Smetherman, your journey is just so inspiring. I'm in awe just hearing all your experiences. So tell us, what can early and mid-career physicians do to get more involved in ACR, SBI, or similar other national organizations? More importantly, as we know, our clinical practices keep getting busier and busier. So how does one prioritize their level of involvement in these organizations? And balance it with their work and life?
So I think that's not only a great question, but also a very important question. So I think there are many opportunities. I mean, doing things like what you were doing, that's so important, being the editor of the SBI newsletter. But they all do take time. And I wasn't, I was being completely candid when I said that at times my career has very much felt like that Sheryl Sandberg jungle gym. And there are times when I was more involved in local and national organizations and times when I was less involved, depending on what else was going on in my life. So I do think keeping all of that, keeping an eye on all of it is probably important. I do think the goal should be to have a long and fulfilling and professionally satisfying career, at least for me, whatever that looks like to you. Some people, that might be just being the absolute best clinician for your patients and part of a multidisciplinary team or a radiology team. Other people may really want to be involved in leadership and mentorship. Other people may really want to be great researchers. So I think we have to remember there are lots of different options. But sometimes, depending on what's going on in your personal life, they may have to take a back seat. And that's okay too, because, at least for me, I've always felt like I was in it for the long haul. And I was more focused on trying to continue to learn and keep it interesting. And if an interesting opportunity came along, uh, I'd weigh it out. But if I felt like I was going to learn something, even if it wasn't necessarily, oh, this is going to springboard to XYZ chance, if I was going to come out of it learning something, I'd probably give it a shot if I could make it all work. But I do think, um, particularly, as women physicians and balancing all of those things, it's okay if it's not like a straight shot, right? So I think, and I think there are small ways to be involved. You can just go to your local chapter meetings, learn from other people. So it doesn't have to be all even official roles. So I guess my advice would be true to yourself, keep learning, and at least for me, what's probably been more successful is trying to make sure that I'm always growing, always learning from other people, and trying to have a lifelong satisfying career, more than, oh well, at age 40 I want to be doing this, and other people maybe being very goal oriented, like that works. It just wasn't how it turned out for me.
Thank you for sharing that. Yeah, I totally believe in just being 1% better tomorrow than yesterday. And
Very well put. Very well put.
so, what are your tips on building oneself to be a future successful leader like you, and also create a healthy, rewarding work environment and career that you can look back and be happy about?
So, and I kind of touched on it already, but I do think continuing throughout your career to learn and acquire skills, and it's been very interesting for me that some of the most valuable skills that I have learned were not the ones that, when I entered an educational program or started in training in an area, turned out to be the ones that were the most valuable. One example I always talk about is probably the most valuable skill I learned in high school was how to type. Um, and I only learned how to type because my grandfather said, and this is, just it comes across as so gender biased now, but he was like, well, if you're a woman and you can type, you'll always be able to get a job. And so he actually paid for me to go to a summer course. And it was a little sort of grumbling, because even at that age, I thought I wanted to become a physician. But it turned out to be, like in our digital world, probably the most valuable skill I got in high school. Another thing, as I became more interested in healthcare economics, I decided at around age 50 to go back and get an MBA. I'd already had a master's in public health, but I was really becoming much more interested in economics and healthcare economics. And so looked at a lot of different programs, wound up finding one that kind of fit with my lifestyle. And really enjoyed that program, have utilized that information in lots of different ways. But one of the things that was a necessity for me at that stage in my career, in my life, was that I really needed, and this was a little ahead of its time, I really needed a program that was 100% virtual. I wanted a real school that had an MBA program before, but I needed one that was going to be virtual, that had some asynchronous learning to it, also that was big enough that if you had to stop maybe for a semester and then pick it back up, that you wouldn't have to wait like a year or a year and a half, because some of those programs you move through as a cohort, which is very nice. But I knew for me that things might change at work or in my personal life or whatever that might necessitate me, taking a break and coming back in. And I didn't want to have to wait for another whole cohort to get to the same place. And so I did wind up finding that. I actually found one through the LSU system, LSU Shreveport. It checked every box, and it was actually quite economical since I had in-state tuition. But one skill that I was learning as I was going through this and didn't even realize it was I learned a whole lot about virtual education. And the last time I'd gone to school, it was textbooks and highlighters and clicky pens, and this was Zoom meetings and organizing these different work groups and people working on projects asynchronously and through digital communication and simulations that we did. And all of a sudden the pandemic hit. And being facile with all of those things turned out to be an unexpected advantage in trying to just quickly get our educational programs here in our department on track, being able to do virtual signouts with Zoom for our residents, you know, transitioning into what is now a combination of on-site, hybrid, and remote um, workspaces. And so anyway, it certainly was not much like typing in high school. It was not the skill that I thought I was acquiring, but it turned out to be one of the most valuable. So again, I think if you just, as you think about having a successful career, I think if you focus more on being continually learning and open to new things, whether it's new technology that comes about that might benefit patients. We just started last year, for instance, contrast enhanced mammo. And we just found out this week that we got approval to get the biopsy package for that. So, things like that, whether it's technical improvements or your own personal skill set, that I think it's probably the most important thing. And yes, you do have to have things on your resume and all of those different things. But I do think at the end of the day, having the skills and the knowledge is every bit as important. And as we've been saying, if you really want, at the end of the day, to be able to look back at your career and be like, wow, this was really interesting and fun. And it turned out to be interesting in ways that I might not have thought of. If I think of myself at 20, what did I think going to medical school and being a doctor was going to be like? It probably wouldn't have really looked like this. But it's wound up being very interesting and very fulfilling.
Thank you for sharing that. And it's very inspiring, not just for me, for all of our audiences out there who are
Yeah.
trying to imbibe and learn from everything you've experienced so far. Finally, I would like to ask you if you had one advice to give to all the young SBI members, what would it be?
So, I think we are at a very critical juncture in our specialty. I think the workforce shortage is real. But I also think we're at a time of just amazing opportunities. I think the potential, and breast radiologists have really led the way in this, but the potential for radiology to be in the driver's seat for population health and screening for other disease processes. I mean, we are right there and we are uniquely positioned not only to be the leaders in that sphere, but also in artificial intelligence. We've been using CAD for 25 years in breast radiology. We know not only the pros, but the cons and the things that you have to be cautious about. So what I would say is, even though we've got all of these challenges, we have just got to stay positive. That would be my one piece of advice. The challenges will get worked out. We've all got to work together. We've got to increase the pipeline. But I also think we have the most amazing technology we've ever had in the history of mankind right now to help patients. Radiologists, I think, are uniquely positioned among different specialties. So I would say for our SBI members, be ready to seize the opportunities, stay positive. Yes, we all have to work together to grow the workforce. And yes, we have to figure out how to use AI to help us work better and smarter. And how do we increase the pipeline? But I think at the end of the day, work together and stay positive. And I think we're all going to be not just fine, but I think we just have amazing opportunities ahead of us.
Thank you so much, Dr. Smetherman. That was amazing.
Oh.
Uh, on behalf of Society of Breast Imaging and our newsletter committee, I really want to thank you to take time out to talk to us today. We're also inspired, and we can't wait to see you do great things in your new role as the ACR CEO. So thank you so much.
Well, thank you. And I look forward to working with you and all of our radiologist colleagues and SBI members as we all move forward in the future together. So thank you for giving me the chance to speak with you today. And again, as I said before, thank you for doing this important job of being the editor for the SBI newsletter.
Thank you. Have a good rest of your day.
You too.